My name is Mamie. I work in television. I'm a wife of 10 years, a mother to a 9-year-old. I like photography. I love shopping. It's one of my favorite things. Love to travel, go to the beach, love to swim. I have severe Crohn's disease. I was diagnosed about 8 years ago. My daughter was less than a year old when I started having symptoms. So I sought out a gastroenterologist in my town, saw him, started the battery of tests to figure out what was going on. And eventually ended up in the hospital. I went through months of research and doctor's appointments, and they said, no, you're just a new mom, you're just tired. But I knew that I was struggling with real symptoms. When I was in the hospital, I had my very first colonoscopy, and that's when I was originally diagnosed. I had a young child, I was newly married, I didn't know what this was gonna mean for us. My doctor and I tried several medications, but none of them helped me with my symptoms for more than a few months. And so I did research, and I started looking around, and I started calling people and saying, who do you know? And a friend led me in the direction of the doctor that I'm seeing now. The first time I saw him, he said, there's so many more options for you. There are so many more choices for you, and let's get started. And he said, you can try a drug called Intivio. So I tried Intivio, and after a while, it actually began helping some of my symptoms. And now my doctor says I'm in remission. I just want to let other people know that there are many options available, so you should talk to your doctor and explore those with them.
Intivio is a prescription medicine used in adults with moderately to severely active ulcerative colitis or Crohn's disease when certain other medications have not worked well enough or cannot be tolerated. Important safety information about Intivio, vedolizumab. Do not receive Intivio if you have had an allergic reaction to Intivio or any of its ingredients. Intivio may cause serious side effects, including infusion-related and serious allergic reactions can happen while you are receiving Intivio or several hours after treatment. You may need treatment if you have an allergic reaction. Tell your healthcare provider or get immediate medical help if you get any of these symptoms during or after an infusion of Intivio: rash, itching, swelling of your lips, tongue, throat, or face, shortness of breath or trouble breathing, wheezing, dizziness, feeling hot, or palpitations. Feel like your heart is racing. Intivio may increase your risk of getting a serious infection. Before receiving and during treatment with Intivio, tell your healthcare provider if you think you have an infection or symptoms of an infection, such as fever, chills, muscle aches, cough, shortness of breath, runny nose, sore throat, red or painful skin or sores on your body, tiredness, or pain during urination. People with weakened immune systems can get progressive multifocal leukoencephalopathy, PML, a rare serious brain infection caused by a virus. Although unlikely while receiving Intivio, a risk of PML cannot be ruled out. PML can result in death or severe disability. There is no known treatment, prevention, or cure for PML. Tell your healthcare provider right away if you have any of the following symptoms: confusion or problems thinking, loss of balance, change in the way you walk or talk, decreased strength or weakness on one side of the body, blurred vision, or loss of vision. Liver problems can happen in people who receive Intivio. Tell your healthcare provider right away if you have any of the following symptoms: tiredness, loss of appetite, pain on the right side of your abdomen, dark urine or yellowing of the skin and eyes, jaundice. The most common side effects of Intivio include common cold, headache, joint pain, nausea, fever, infections of the nose and throat, tiredness, cough, bronchitis, flu, back pain, rash, itching, sinus infection, throat pain, and pain in extremities. These are not all the possible side effects of Intivio. Call your healthcare provider for medical advice about side effects. Before receiving Intivio, tell your healthcare provider about all of your medical conditions, including if you have or think you may have an infection, or have infections that keep coming back, have liver problems, have tuberculosis, TB, or have been in close contact with someone with TB, have recently received or are scheduled to receive a vaccine, or if you are pregnant, breastfeeding, plan to become pregnant, or plan to breastfeed. Please see accompanying full prescribing information, including the medication guide for Intivio, and talk with your healthcare provider. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088. Uses of Intivio, vedolizumab. Intivio is a prescription medicine used in adults for the treatment of moderately to severely active ulcerative colitis, moderately to severely active Crohn's disease,